Day and night, night and day. You're thinking about me and you say that you're living in ecstasy. Ecstasy. Am I your snuggles, your only love bug? If so, come and give your angel a hug. You can't live without me, no me without you. So honey child, here's what I'll do. Yeah. To prove my love is deeper than the deepest well, I'll serenade you to the backing of a church bell. I'm your one and only, and you're my only one. I'm thinking about you because you're second to none.
Okay, we're coming in. If talking about your health gives you ecstasy, well, right now you're about to get a good dose of that because it's time for soul food. And soul food is all about your health and wellness here on Breakfast in Bed on Smooth 98.1. Love music, love life. We are streaming live right now, so you can go to youtube.com/ smooth 981 FM for you to see my face. Yes, I know you want to see my face. Yes, you know. And then to see that of my special guest. Also, that allows you to drop your comment in the chat box. Any questions that you have, if you want to seek clarifications or you are not so sure about something you heard about the topic we're about to discuss, you should drop it there. You can also come to WhatsApp. It is 0809 444 0981, and you can call the number 014489981. Twitter is not left out, as Smooth981FM is the tag or the handle, and then hashtag strictly, not strictly so, Breakfast in Bed 981. That's it. All right, so I have made the mention earlier that our topic this morning is polycystic ovarian syndrome, and I could not even think of another person who will do justice to that topic and shed so much light and practical examples than my special guest. You know him, he is not a stranger at all to the show. He's somebody who's very vast and has several years of experience. He's the convener of the Dr. Abayomi Ajayi Physicians Mentoring Program that is for young medical professionals. He is also the founder of the Physicians Roundtable. He is in charge of the Endometriosis Support Group and the co-founder of African Endometriosis Awareness and Support Foundation. Of course, he is the Chief Executive Officer of Nordica Fertility Centre. Ladies and gentlemen, Dr. Abayomi Ajayi. Good morning, sir.
Good morning.
Thank
Great
you.
to be with you again.
Thank you so much for the honor, of always coming back here and explaining more and more about whatever it is I would like to say. Thank you.
My pleasure.
All right, so let's get down to the basics. This time, I don't even want just the definition. I want to understand what this condition is. And this is one of the reasons I want to understand it. So there was, so many weeks back, somebody made a video, and the person, it was one of all this funny videos, something that's supposed to be funny, but I didn't really find it funny. And then going by some of the comments, they didn't really find it funny. So the person said, name some girls. If you see a girl who's hairy, would you assume that she came from? And a number of people in the comment section said, she must be an Igbo girl for her to be hairy, to have beards, for her to have long facial hairs, basically, and for her to really be shaving every day because of the hairiness. And then in the comment section, people were like, no, you don't get to make fun of people like that. What if she's going through, or she has a condition called polycystic ovarian syndrome? And I thought, okay, this is it. And then I checked online and I realized, oh, there is a possibility. So in the actual sense, what is polycystic ovarian syndrome and why is that hairiness a part of it?
Thank you so much. That's a wonderful way to start. When we're talking about polycystic ovarian syndrome, we're talking about the commonest, probably hormonal disorder in women in their reproductive age group. Well, maybe to start with. Hairiness might not always be as a result of PCOS. We call it PCOS.
Yes,
That's
for
what,
yeah.
okay. Because some people are just hairy, but many people, it might just be polycystic ovarian syndrome. Now, polycystic ovarian syndrome, it's for some strange reasons. Some women tend to have the male hormone. You know, all of us have we have male
Male and
hormone, female
female.
hormone. I have some female hormone. Yours is just probably just more than mine. But for some reason, some women tend to have a higher degree of male hormones in them. And this is what is responsible for polycystic ovarian syndrome, we think. We don't know why some women have it and some don't have it. But now this now manifests in many ways, one of which is what you said. But the commonest way this manifests really and truly is irregular menstrual cycle. And when we say irregular menstrual cycle, we need to be careful here because sometimes I get strange phone calls and somebody says, oh, my menses was on the 4th last month and is on the 1st this month. And that means it's irregular. Nope. What we say is that it's a range. It's 21 plus or minus 7, it's 28 plus or minus 7 days. So it can be as short as 21 days is okay. It can be as long as 35 days. If it's longer than 35 days, that's when we say it's irregular. So people who have polycystic ovarian syndrome normally tend to have less than about 9 menstrual cycles in a year. Okay. For some, it's only 2, 3. Yeah. And so that usually is the first thing. And then also when they bleed, because they sort of built up the endometrium, which is what you shed during your menstrual cycle, it tends to be heavier and might be prolonged than the normal 4 or 5 days that many people will have. They could have for a week, they could have for 10 days. So your menstrual cycle is the first thing that might just be a pointer. Then other things that might also show that you have a higher level of male hormone could be, just like we said here, hairiness, could be that you have a male pattern baldness, could also, hairs in some other places, your chest, and so on and so forth. And some of these people also tend to have infertility. About 50% of them tend to be obese because of this, all this because of these hormones, because we think this really what causes it is because they have some problem with insulin. Insulin is the hormone that we all know is associated with diabetes. So people, and that's one of the reasons why it's important that this diagnosis is made early, because apart from that, the fact that they might have challenges in having children, if there is nothing done about this, there's some other sequelae in later life that could have happened. For example, they could be more predisposed to diabetes. Okay, in later life, they could be more predisposed to heart diseases. So, and that's why we're saying that apart from the fact that they might have challenges in conceiving, it's better that this hormonal imbalance, something is done about it. With tongue in cheek, because I hear a lot of things, hormonal imbalance, polycystic ovarian syndrome is usually, to make a diagnosis, we require 2 out of 3 things.
Okay.
The first thing is this irregular menstrual cycle, just like we said. The second thing is that you probably have this male kind of characteristics, either you are hairy like a man, or that also you can have polycystic ovaries on ultrasound. But you see, what we see most of the time is that people when they just find polycystic ovaries, or poly means many.
Yes.
When they find many cysts on their ovaries, they say this is polycystic ovaries syndrome. It's not, because you need 2 out of 3 of these features for you to be able to say a lady has polycystic ovarian syndrome.
Okay, I have many questions burning in my head, but we'll take this break, and when we come back, we'll settle down into it. If you'd like to be a part of it, also you can. 014489981 is the number to call. So after this break, I'll be back to take maybe your calls or messages. You're listening to Breakfast in Bed here on Smooth 98.1.
Fly, silky smooth, 98.1.
Darling,
OneXBet, easy betting, easy winning. OneXBet na the sharing service to make deposits easily with high odds and yakata bonus on the spot. Click onexbet.ng now to register. Use best odds NG as promo code to get 300% bonus up to 189,280 naira on top your first deposit. It dey easy to use and it dey easy to win. OneXBet, the reliable bookmaker.
Please, may I take your order, sir?
Okay. What would you like to have?
I'll have a cappuccino.
Breakfast is on the menu. Wake up and smell the coffee for the perfect start to your day. It's people and lifestyles, tips and information.
Anything can go wrong. That's why I tell people don't play with your
Indulge
body.
yourself in some soul food. Get your vitals active in health and fitness. And discover music from around the world in Smooth Explorer.
We believe that music comes from the planet of the earth.
It's breakfast just for you. Breakfast in bed every Saturday from 7 a.m.
This is your girl Ufoma McDermott, and you're listening to Smooth 98.1. You love me.
Smooth 98.1. Love music, love life. You're listening to Soul Food right now, and it is all about your health. But this morning we're talking about polycystic ovarian syndrome, because September happens to be the month that light gets extra on the issue, and then there are many conversations and awareness drive on it, and this is one of it. So if you want to contribute or you want to ask a question, you can call the number 01-448-9981, or you can decide to text 0809-444-0981. So I'd like to get a bit of data. Now, I was going through some data online, which we already know that here in Nigeria or West Africa, we just have that paucity of data. But a little bit of what I was able to pull up. Now, according to one study that was done in Enugu precisely, and it was done by a number of people, and it was published in this National Library of Medicine. It was titled Prevalence, Presentation and Management of PCOS in Enugu. The sample size was 342 women. And then turns out that they said 1 in 6 infertile women had PCOS. Now, another study that was done in Port Harcourt, the sample size was 174 women. It said that the prevalence was 16.7%. That was in 2019, by the way. And then according to another one done in Benin, it said that the prevalence was 13.8%. I did not find anyone in Southwest. So going by your years of experience, what would you tag or term the prevalence as? How common is PCOS in women?
Well, if I shoot from my hips, because like you said, there is data positive, it might be as common as maybe in infertility, because it's the commonest hormonal problem that we have. Maybe 1 in 8, 1 in 10 also will have PCOS. Don't forget that there is also geographical variation in the incidence of polycystic ovarian syndrome.
Oh.
Yeah, so usually it might be a little bit more prevalent in some places, like especially the airiness and stuff like that, part of it in Mediterranean and so on and so forth. But it's something like the hormonal, how common it is, it might just be. The most important thing is, can we make a diagnosis each time we see it?
Who can make a diagnosis of, okay, let me quickly take this call and say, hello, good morning. Oh, please call back if you can. 01-448-9981. So who is in the best position to make a diagnosis of PCOS?
Seriously, anybody, any doctor can make a diagnosis, because it's most of the time staring at you in the face. If you know what to look out for, and that's where programs, awareness programs are very important, even for the doctors, because it's not everybody that is fortunate to see a gynecologist. You know, the fact that the gatekeeper, who are the GPs, can recognize the problems that need to be escalated is probably the hallmark of a good health system. So any doctor can make a diagnosis of or have a suspicion of PCOS. And like we said, two of the 3 things can be historical. Just taking the history, irregular menses, and you can see that this woman has male pattern hair distribution. You know, those. So you can. The next thing is to do the investigations, to do a scan which is commonplace now in Nigeria. Well, also, of course, accuracy of scans also depend on the equipment and the observer. But I think in a place like Lagos, we do fairly well. But I don't know about that. Well, I know because I have clinics all over Nigeria, so I have a fair idea what happens in other parts of Nigeria. But Lagos is really, I think people in Lagos should actually consider themselves very lucky about the standard of healthcare that they enjoy. It's not like that throughout Nigeria. But the more we talk about it, the more there. And this is not a Nigerian thing alone. The awareness has been, and that's why a whole month now, September it's for polycystic ovarian syndrome, because of not only that, like we said, not only because of infertility, but because there's some other consequences that this can have.
I was going to ask the other complications this could bring on.
Yes, women with PCOS are predisposed to diabetes, either in pregnancy when they get pregnant, or even in later life when they don't develop. They are more predisposed to hypertension.
Sorry.
Thank you. Either in pregnancy or even in later life. They are more predisposed to sleep apneas, because majority of them are on the big side. They are more predisposed to sleep apneas, and sleep apneas also can lead to heart diseases, and so they are more predisposed to heart disease. They are more predisposed to depression, because of the hormones that are doing up and down in them. Then they also they could have what we call abnormal uterine bleeding. They're just bleeding and nobody knows why they're bleeding, So they are bleeding irregularly. And then, of course, they are also more predisposed to cancer of the uterus. So these are some of the things that can happen. It does not mean that when you have polycystic ovaries, you have any of this, especially when the diagnosis is made and the hormones are corrected. So that's probably the key reason why it's important to talk about this condition.
Okay, so I am standing in the position of the layman now. One of the things I would like to know is it that the longer this hormonal imbalance stays, the worse the complications?
Exactly. Exactly. Because it's like your body is being triggered. Okay, don't forget that what we said is that these women don't ovulate regularly, so that's why they don't menstruate regularly. So it's like your hormones are building up, and the way a woman's body is wired is that estrogen acts for some time and then progesterone comes in. Okay, but these people, estrogen acts for a long time, and they build up the endometrium. They build every other organ in the body is subjected to estrogen effect, and they rarely have the trigger from progesterone that should make them bleed.
Okay, so this PCOS, when should a woman do you find it through some routine checkup? Is it that, the way we say you can schedule routine checkup? So should a woman go for a routine checkup just to know her level of hormonal balance, or it only should be when she starts seeing irregular periods or some heavy bleeding?
I think you should wait until, that's one of the things because what I say to women is that you are your own first doctor. Okay, if you know what to look out for, then things become much easier. Everybody is their own first doctor. You live with yourself.
Yeah.
You just see the doctor for 20 minutes. So if you know what to look out for, it makes life much easier. If, for example, if your menses is regular, and then you are not likely to have polycystic ovarian syndrome. Even if that's what I said, and then okay, you don't have any male pattern air distribution. Even if they find polycystic ovaries on your scan, that is not enough to diagnose polycystic, because there's so many reasons. The scan is like looking at, those days, I don't know, when we used to have photographs that you have negatives.
Yeah.
Scan is almost like that. So sometimes you don't know why you have the cyst that you're seeing. It could be some other things apart from polycystic ovarian syndrome. So, but it's a wake-up call for you to find out, okay, what's this, even if I don't have the symptoms.
Are there risk factors? Because earlier you said that even though the causes might not be fully unknown, but the major one we can finger in this situation is the hormonal imbalance. But are there risk factors that lead up to that?
Sure. Heredity.
Oh,
You can inherit it.
that's gene. Anything. Anytime I hear anything
Well,
heredity, it just.
that is the future of medicine,
Hmm,
because majority of what we are, who we are, comes from our genes.
true.
So we need to pay more attention to it. But so heredity. But you know what? Some of the things that we're saying is that there is this insulin resistance in some of these people. We don't know why there's insulin resistance. You know what insulin does normally is that it's the hormone that makes you to use glucose in your system.
Mm,
So when you eat, and it's metabolized to glucose, these muscles, in order for them to be able to use it, need insulin to pump the glucose inside. So in these people, they have the insulin, but there is a resistance to the action of insulin. So the body senses as if they don't have insulin, produces more insulin.
mm.
And that's what leads to these male hormones being
Oh.
high in them, because they are having unnecessary insulin in their body. And that's why sometimes the drugs that they use sometimes for polycystic ovarian syndrome is the drug that they use for diabetes.
Oh.
Yeah. So some women now, especially those of us who practice assisted conception, and you say, oh, you have to use this drug. Say, oh, no, but that's what my dad was using for diabetes. Yeah. Yeah. But we don't use it like forever.
Okay, now that you mentioned drug, I came across it somewhere that part of the drugs you can use in at least trying to correct the situation is birth control pill.
Sure. Sure. Oh,
Oh.
why did you do that?
Oh, because I thought, okay, how does that come into this, especially for somebody who's trying to get pregnant?
Yeah, but that's it. When you're trying to get pregnant, nobody's probably going to give you birth control pills. But because at that point in time, what we want to do is ovulation induction.
Oh.
Okay. Yeah. Usually, birth control pills is for those who are not. Don't forget that this condition starts probably from your first menses. Okay, so younger people who are not even ready to have children can have polycystic ovarian syndrome.
So it's just there dormant.
It's just there, yeah, waiting for it to be discovered. So they can have oral pills or birth control pills, like you call them. So they can have that. But if somebody is trying to get pregnant, then what we'll be doing is to induce ovulation. And so it's a different kettle of fish. So really and truly, sometimes even it depends on the symptom that you want to treat at a particular point in time. Is it the hairiness? Sometimes you might not have to do that. So yeah.
Are there other forms? Okay, I think you just answered it, that it depends on the symptoms you're trying to treat.
Control, yeah.
But generally, if there was a broad management for PCOS,
lifestyle modification. You see, all these things are just from the basics. Live healthy. It's applies to almost everything, and that's the thing that we're missing, that we need to live healthily. Your diet, we're made up from what we eat. So a moderate exercise, they're very important. Maintain your healthy weight. These are, because people, we said about 50% are obese. When they cut down on their body weight by about 5%, majority of the symptoms disappear.
But I'm curious, is it possible that some of the drugs they might be given to address this issue can also cause weight gain?
Well, sometimes, especially when you're trying to induce ovulation, that might be a tug and pull. But usually, when you achieve what you want to achieve, then you might give a little. But yeah, because some people, yes, you're right. Some women, after using ovulation induction drugs, say, oh, I'm putting on weight. But fine, if you are able to drop the weight before you even start, then maybe at the end of it, we just reach a balance.
Okay, I'll take this message from Ian on WhatsApp. Says, please, I need a recording of this show. We are recording it right now, and you can go to our YouTube channel. I will save the video there for you. So just go to youtube.com/smooth91FM Lagos. The video is there. You can subscribe to our YouTube channel so that next time you can see the video. so you can share it also with somebody. And he says, I have some lady friends who need to listen to this and maybe even seek a consultation afterwards. In fact, this show is like an eye opener for me. It's helping me connect a lot of dots, and it's painting a scary image of some of my very close female friends. Please, how can I reach the doctor in the event of need for a consultation? Don't worry, we'll let you know that. And he says he's a male. Well, this is not just for the females, this is for the males who care about the females, because at least one person is female in your life. So thank you so much for your concern and love for them, and share it with them. So I remember there was a time we talked about freezing eggs.
Yeah.
So somebody who doesn't know her fate in terms of this PCOS and wants to have children, and maybe age is not on her side, is egg freezing an option? But I'm again looking at the aspect where she's not exactly ovulating well. So, okay, please shed more light on that.
Okay, now that you've gone into that, people who have polycystic ovarian syndrome, let's look at, we say they have many cysts. Those cysts are actually eggs that have been arrested in various forms of stages of development. So when they tend to have low quality eggs, okay, because those eggs are not, if you like, fresh. Do you understand? They've been arrested at different stages. They tend to have poor quality eggs, but that does not mean, and sometimes that's what is making them finding it difficult to get pregnant. But this does not mean they can't get pregnant, because out of some of those poor quality, there might be one or two good quality ones. And why I'm saying this is that because sometimes when you want to freeze eggs with these people, they tend to make a lot of eggs. They tend to be predisposed to what we call ovarian hyperstimulation, because of those many eggs that have been arrested before you even start your ovulation induction. So you need a very good doctor to do this. Now there's some regimen now that are available that will almost eliminate ovarian hyperstimulation, but cannot improve the quality of the eggs. So sometimes you have to be a little bit patient in this. They might need to have 2-3 cycles in order for you to be able to get good eggs to freeze.
Oh, okay. That is very enlightening. I'm curious though. Poor quality eggs doesn't mean poor babies, or it won't turn into babies at all.
Nature is so kind. It does not allow, the best quality control is in the body. So once there is a fault, once there is anything, that's why we don't see people with 2 heads. Because of the quality control system.
Nice. Okay, that's good to know. All right, thank you so much. Time actually is out, but what would be your last word, advice, recommendation, anything?
Well, I think it's usually the same, almost the same. Knowledge is power. Know a lot about yourself. So many people know so many things about so many things, but not their body. The most valuable asset you have is your body. You must know about. I'm not telling you to become a doctor. Know enough about your body. It saves you a lot of heartache, and that's all I'm going to say. Prevents quacks from using you as a pawn. Prevents so many things, and you know at what point things are not going on well with yourself, and know when to, the kind of help that you need to seek.
Just to be very clear, knowing about your body, it means being in tune with your body and being very sensitive to changes, or checking out information online, because some people in a bid to know more about their body, Google is their friend, and whenever they have any slight change, Google, my body temperature is very hot today, what is wrong with me, that kind of thing. So
no, Google might not replace your doctor, but the thing is that even online, you need to be careful what you read, because there's also a lot of junk online. So, but look at, there's some verified websites. There's some, for example, if you have infertility and you're reading some things about, I don't want to say, but some things that they just wishy-washy. But you know yourself that this is not verified. But if you go to NICE, National Institute of Clinical Excellence, you go to ASRM, you go to recognized bodies, not someone's opinion, then you're like, you can't be wrong.
All right. Thank you so much. Know about your body, know about your health, but be careful of where you consume the information, because like somebody said, you can't afford any misinformation. You can afford a misinformation in any other aspect, but once it concerns your health, even a misspelling can kill you. So please be very careful. And that's all we can take. But like I mentioned earlier, you can go back to YouTube. We have saved this recording for you. Share it with somebody who you think needs to be aware of this, because it's all about the awareness on polycystic ovarian syndrome. Dr. Abayomi has said that information is power. Knowledge is key. We can never overemphasize it. If you do not know something, you will not know what to do with it. So please and please have the right information. And that's why you need to stay tuned to us, because we'll bring you quality, first class, first grade, excellent information as regards your health. I look forward to another conversation with you.
Same here.
Thank you so much. The next segment, of course, will be the kids. They have to come around, and 8:40 is the time for Curious Minds. Stay with us.
Of music, it's smooth music.
Thank you so much.
Thank you.
Smooth.
So how do I give your oh my days, I forgot to mention. Oh, damn.
No problem.
I'll give it to